Good evening, doctors. Welcome back once again to the free webinar conducted by Online Dentistry. Thank you for joining us early. Please make yourself comfortable while we continue to admit all the candidates into the webinar. Please make sure you can hear my voice clearly and also ensure that the slide that is shared at this point of time is visible. All candidates who require a certificate of participation for the program, please ensure you have registered a free account on our website and have enrolled for this particular program. Please give us another 1 more minute. We'll be starting soon. In the meantime, please sit back, relax, grab a pen and paper, as it's going to be a knowledge pack session. A special announcement: all candidates who require a certificate of participation for the program and also want to claim the free e-poster and the sleep study prescription, please make sure you register a free account on our website and enroll for this program. Thank you, doctors, for joining in early. We are stabilizing both Zoom and YouTube at this point of time. We'll be starting soon. Good evening, doctors. Welcome back once again to the free webinar conducted by Online Dentistry. Thank you for joining us early. Please make yourself comfortable while we continue to admit the candidates into the webinar. All candidates who require a certificate of participation for the program, please ensure that you have registered a free account on our website and have enrolled for this program. We have stabilized both Zoom and YouTube. Many candidates are joining in. Let us start the session and we'll have all the candidates joining later also. So thank you, doctors, for joining in early. Let us have a quick introduction to Online Dentistry. Online Dentistry is a firm dedicated to imparting quality knowledge to dentists globally. Our motto is to redefine dental education system, and that is available to dentists, and we have been striving toward the same for the past 13 years. Here is our 13-year history in numbers. We were established in 2008, and till date, we have conducted 122 offline courses in and around India. We have conducted 500 plus online courses during the pandemic, and we at present amass a total of more than 20,000 members on our platforms online from 44 countries. The organization was founded and is led by none other than the speaker and faculty for today, Dr. Binuti Abraham. Sir is a dentist by profession, but a teacher by passion. Sir is a world-renowned speaker and has been a keynote speaker for ISPPD for the past 6 years. Sir is a teacher who simplifies clinical concepts in dentistry so that practitioners can implement them the very next day. Introducing the head of academics, Professor Dr. Joby Peter. Sir is a passionate teacher and a veteran pediatric dentist. Sir is at present the head of Department of Pediatric and Preventive Dentistry at the prestigious Annur Dental College and Research Center, Kerala. Sir, throughout his career, has practiced and preached the philosophy, catch them early, watch them grow. Over the past years, online dentistry has grown to 10 centers across India, truly redefining the concept of continuing dental education. We thank our coordinators at each center who have supported us throughout the years. At present, all offline courses are suspended due to the restrictions of the pandemic. We have been receiving tremendous number of requests all along this year regarding the offline courses. And if the situation of the pandemic resolves, we'll definitely be coming out with an offline course soon. Regarding the types of webinars we conduct, we have both free webinars and paid webinars. Free webinars, like the one that you're attending at this point, are 1 hour short webinars that are packed with informations, guaranteed certificates of participation, and free goodies at times. Paid webinars has spanned between 3 hours to 3 days. They are full day programs with certificates of participation, extensive discussions, and virtual hands-on. We also provide post-class support through the WhatsApp groups for 6 months for each session. Do not miss these webinars that are coming up. As you can see, we are bringing out topics that are least explored by dental surgeons but play a pivotal role in the clinical practice. We are trying to put together the best faculties in each field so as to help the entire dental fraternity to advance into the next generation of clinical practice. This month is indeed a knowledge-packed bonanza, as we have a surprise for you. Online dentistry has officially associated with the Faculty of Dentistry, Lincoln University, Malaysia, which is indeed a milestone achievement for the team. We thank all our dedicated candidates who have attended our programs and helped take online dentistry to the next level in dental education. And as a part of our venture, we have already launched our first international accredited CDE on the topic interceptive and preventive orthodontics for pediatric cases. Please make sure you do not miss this session. We have received tremendous response towards the same, and the seats are getting filled quickly. Very few seats are remaining at this point, and you'll be certified by the Lincoln University of Malaysia on this topic. So make sure you do not miss this chance to revamp the way you manage your pediatric cases and help make the rest of your practice the best of your practice. For more details about us and about our programs, you can visit www.onlinedentistry.in. If you are not yet a member in our WhatsApp groups, please send us a message on 98470 or +91 94463 Thank you, doctors, for patient listening. I now hand over the podium to the speaker for the day, the one and only, our founder and CEO, Dr. Binu T. Abraham, sir. Over to you, sir.
Joe?
Yes, sir.
Slides are visible?
Not yet, sir. So you can go back to the PowerPoint.
How about now?
Yeah, your slides are visible now, sir.
All fine. Can I start?
Sir. Hello, sir. Am I audible, sir?
Yes, you are audible.
Yes, sir. Sir, your video has not appeared, sir. So let's quickly fix this fast so that the candidates are getting the best possible session for tonight. So you can stop your screen share at this point, sir.
Okay.
So you can go back to the PowerPoint.
Okay.
You can open the second one, sir, which shows it in the full screen mode. Yes. Click on it, sir. You're all set to go, sir.
All right.
Yeah.
Ready to go?
We're ready to go, sir. All the best, sir.
Hello, all those who can come in video, please come in video. Let me see some faces. If it's okay with you guys. Few artists were inside a room. They were asked to look out of the window and draw what they see. They looked out of the window. They are supposed to look out of the window and draw what they see. very few artists actually looked out of the window and drew that beautiful scenery outside. You know what the majority of the artists did? Majority of the artists drew a window. So easy, yeah? That's such a nice thing to do. They just drew a window. It's such an easy thing to do. Guys, my topic tonight is look out of the window. When I say window, I am talking about that small little mouth which you're looking every day. Every day, practitioners listening to me. Nasir sir, thank you so much for coming in video, sir. Thank you so much. Right from last year lockdown, you have been there. All the programs. I'm sure this program you're repeating multiple times. Am I right, sir? But there is some difference every time, as you know. So look out of that small window, that mouth. That is my topic today. Patient walks into your clinic, you look at the mouth and you talk about the caries here, missing teeth here, bridge possibility here, implant possibility here because you have your EMIs and all that. So implant possibilities. Guys, I'm talking about looking out of the window. I'm talking about an entirely different concept altogether here called as disturbed sleep. Have you ever looked at your patient, whether that particular patient, whether kid or adult, I don't care, are they disturbed in their sleep? 7 clinical indicators. 7 clinical indicators. Tomorrow, when you go to clinic, when you start seeing patients, whether kids or adults, but mostly kids, if you see these 7 clinical indicators tomorrow, message me personally. Any of the 7 indicators you see tomorrow, message me personally. Please, my number I'll give at the end of the lecture. 7 clinical indicators a dentist should not miss in practice tomorrow morning onwards. Look out of the window tomorrow morning onwards. Patient has come to you with pain, sir, severe pain here, sir. Look at that painful teeth. Fine, but look out of the window, the face, the gait, the patient, the way the patient walked into the clinic, the gait, it's so important. I have classified that into 2 extraoral and intraoral features. Let's talk about extraoral first. Extraorally, tomorrow you see a patient, look at the face, the length of the face. Now, facial length is something which we cannot directly correlate because you see the patient for the first time. How can you actually tell whether it's a long face or not? It's not very easy. You have to see the patient once, and then after 3 months or so, when you see the patient again, you might notice that this is longer. This girl is becoming longer and longer. Have you noticed that? Have you noticed that point from the nasion to the menton? That line, the length of the face, is it increasing every visit you see her? See, every visit you might be seeing her, her cavities, fluoride therapies or whatever. But are you looking at this part of this patient? Long face. You know what? There are analysis to even know that. There are analysis to know the posterior height and the anterior height. Posterior height from the sella to the gonion and anterior height from the nasion to the menton. Some people would be thinking, oh my God, this fellow thought, he will talk about some sleep and all that. Something related to dentistry. He's talking about cephalometrics, one of the most hated topics right from undergraduate time. He's talking about, yeah, but guys, I do this on a daily basis on my patients. You don't have to be an orthodontist to do this. Just have to look at the posterior height, anterior height, get that millimeter posterior height divided by the anterior height, multiplied by 100. Very difficult to do, huh? Rocket science of what? Posterior height, cella to gonion and nasion to mendon, posterior divided by anterior, multiplied by 100. And if you see that it is 62%, the moment you see that it's less than 62%, you're talking about a vertical grower there. You're talking about a patient having a mandible growing downward. This is only going to become longer and longer as he or she grows. And then the typical stuff, you know, the mesocephalic, brachycephalic, dolichocephalic, all that stuff, you know, dolicho, L for long. So dolicho is long face, just a methodology to remember. That's all. I know there are many dental students listening to me, many entrance aspirants listening to me tonight. So dolicho, dolicho, long face. Meso obviously is meso, the middle. Meso is middle, and brachycephalic is the short face. You've got to know about these three basic stuff for you to identify the longness of the face. Guys, if you, let me go back a slide. If you go back a couple of slides, sorry. If you feel that the patient's face is longer than normal, will you tell your patients? Will you dare to tell your patients? They've never come to you asking for that. But will you dare tell your patients about that? You know what you should tell? You tell 10 parents, I think your daughter is getting a longer face. You tell 10 parents, 7 out of 10 parents might ridicule you. I mean, come on, doctor, don't worry about all that. Look at the teeth. She's not sleeping. It's so painful. You feel it. You're a dentist. You feel it. But 3 out of 10 parents, you never know, might tell, doctor, I was always telling my husband the same thing. Where is she getting this face from? I am not like this. I was not like this when I was young. Where is she getting this long face from? I was actually telling my in-laws and all that. You might, 3 out of 10, you might get some response, guys. And that 3 is important. Understand that 3 is important. Long face. I told about that. This is actually the Jarabak ratio and all that in cephalometrics. I don't want to complicate stuff going to cephalometric analysis with Jarabak ratio and all that. Second clinical indicator. Tomorrow in your clinic, if you see second clinical indicator. 1 second. Sorry for this break. Dr. Joe, are you listening to me? Technical team, anybody listening to me?
Yes, sir.
Is my video clear? I can see some grains or something behind. Is that okay? Am I going okay?
No, sir. It's perfectly fine, sir.
Fine. Sorry, I can see that must be my screen issue. Sorry about that. So, retruded mandible. You see a patient with the mandible way behind. Look from the patient's side view. How many have bothered to actually look from the side view? Because obviously, patient came asking for cavity or pain or whatever. Who is bothered to look from the side view? Look from the side view. See that retrognathic mandible there. Talk to the parents about it. If you do not talk, who will talk? You dentists should be talking. Another case, see that retrognathic mandible there. The moment you identify that, explain that to the parents. One more case, you see that retrognathic mandible, explain that to the parents. As I told you, that 7:3 ratio, 7 parents might say, doctor, you don't worry about all that stuff. We know all that. You worry about what we came for. But 3 out of 10 might look or think differently. Retrognathic mandible. And when you see a retrognathic mandible like that, and if that three parents actually wanted to listen to you, wanted to have a conversation with you, doctor, what did you just say just now? You said that this area is really behind, no? I was actually thinking, is that a problem, doctor? Can we do something about it now? 3 out of 10 have responded, guys. Now, in that one patient, ask that patient to bring the mandible forward. Bring the mandible forward. This is called as visual treatment objective. Visual treatment objective, VTO, or functional treatment objective. Ask the patient to bring the mandible forward. Are you seeing a change in her face? You know what? Record all this. Take a picture of all this. Ask parents, oh my God, now she is looking like me. I never thought this is a problem. From the front view, this is how she was. Ask her to bring the mandible forward. Now she is looking like me. I was wondering why she's not getting that pretty face like me. I've heard many mothers telling all that stuff. Not blaming anybody here, but it's their concern. It's their concern, the back of the head, real back. Why is it real back? Because the main concern is the pain and the shaking teeth and the cavities and all that. Your responsibility is to make it into a concern, because you are dealing with something very, very important here. I'll come to that soon. So retrognathic mandible. The moment you see the mandible is way behind, think once more. Explain to the parents about it. Ask the patient to bring the mandible forward. Take a couple of pictures and show it to the parents. It can make a difference. Number 3, extraoral feature number 3, nasal hump. Has anybody noticed a hump in the nose here? The nose? Come on, dentist here. Why should we look at the hump in the nose and all that? Typical nasal breathers, mouth breathers will have that small hump there, because it's the middle face. Middle face becomes so narrow that this area becomes prominent. It's like folding a paper like this, and there's a prominent area there. You get that nasal hump. Typical sign of a chronic mouth breather. Look out for that and talk about it to the parents. You know what? When you tell about this to the parents, what is going to be the immediate reaction from the parents? 25 years into practice, I'm telling you, you tell your patients tomorrow about this nasal hump. You know what is going to be the first reaction from the parent? Doctor, we know about all that. You don't know my uncle. No, my uncle is a famous ENT surgeon in Kochi. You don't know my uncle. He's such a famous ENT surgeon. He has already told that he has an ENT problem. Already told that he has adenoids, tonsils, he has nasal polyps, he has DNS or whatever, you name it. So they believe in that uncle who is an ENT surgeon. Who is going to listen to you, dentist? Yeah. Who is going to listen to you? You do your job, fillings or whatever. They are not going to listen to you, but please mention about it. They will keep it in the back of their mind. They will go to the Lions Club meeting, Rotary Club meeting next week and tell, you know what, one dentist actually told that my son has a problem while sleeping. My ENT, my uncle actually was not serious about it, but my dentist was telling it is a serious problem. What should I do now? Guys, somebody is thinking now. Mouth breathing, believe me, is a problem. It has to be treated. There is no doubt about it. So I just covered 3 extraoral signs. I just covered 3 extraoral signs. There are many. There are a total of around 17 intra extra put together. The 7 intra extra put together is all I'm talking tonight, because all I've got is little less than 1 hour. So, extraoral feature, third one, nasal hump. There are many like the nearest, the dark circles here, that adenoid phase here. There are many. Yeah, please keep reading. I have put a couple of nice articles in the website. After this, those who are interested in reading more can come to our website and claim those articles. 3 extraoral features: long face, retruded mandible, and hump here. Extraoral features of a typical mouth breather, chronic mouth breather. Let's talk about intraoral features. Intraoral, inside mouth, we are all big time. I know you are heavy into it. Inside mouth, nobody can argue with you guys, because we are dentists. So, intraoral feature, point number 1, open bite. The moment you see that there is an issue with the bite, there's something called as a normal overbite, 2 to 3, 2 to 4 or whatever, and then you see that it's kind of edge to edge. You saw it is edge to edge, but you never mentioned to the parents about it, because in case if they tell that, okay, doctor, fine, so what to do about it? You don't know what to do about it. So you don't mention about it. That's ridiculous. If you do not know about it, explain to them that there are people who know about it and go get treatment, guys. Be ethical. So, if you see that edge-to-edge bite, believe me, it's a sign towards an openness. Within 3 months, 6 months, this is live scenes I am seeing in my patient. 3 months, 6 months, you can see things worsening and things coming to this level. Heavy open bites, adult open bites. You neglected it. This is called a supervised neglect according to dental ethical term. Supervised neglect. You supervise the patient so nicely. Every month, every 3rd month, you did fluoride therapy. Every 5th month, you did fillings and scalings and all that. But you neglected that stuff going on in that mouth, which is open mouth, open bite. Open bite is one sign. You see it, there is a problem. It can be the beginning of a huge problem. It can be started by mouth breathing, or other way around. It's the chicken or the egg that formed first concept. It can be tongue thrusting that started it, mouth breathing followed, or mouth breathing started it. The moment it became open, tongue started thrusting, or you have a 3rd person coming in, thumb sucking. The whole thing would have been started by thumb sucking at the age of 5 years. Openness came already, and then the tongue came in. Guys, this is an area which requires a lot of reading, a lot of studies. This Sunday, Dr. Joby is going to demystify a lot of this stuff in the Malaysian program. Please listen to Dr. Joby this Sunday. It's Malaysian time. So Indian time, it's something like 7 a.m. You'll have to wake up and come this Sunday for a great program by Faculty of Dentistry, Lincoln University, Malaysia, where Dr. Joby is going to talk about all these minor things, all these space maintenance, all these mild open bites and the mouth breathing and the exercises for mouth breathing. All that will be covered this Sunday. Please look into our website. You can get the link to join the program and all that. Do not miss it. It's a beautiful program coming up this Sunday by Dr. Joby on interceptive and preventive orthodontics. So, open bite. Now, constricted upper arch. The moment you see that the upper arch is constricted, why don't you tell parents about it? Why don't you tell parents that, you know what, the premolar width has to be little more? You don't have to talk to them about interpremolar, intercanine, intermolar, and big terminologies here. But tell them that there is something wrong in the dimensions. And it is only going to worsen. Believe me, it is only going to worsen. You see a malocclusion, it is not going to improve. Take it from me. It is only going to worsen, to worse. Look at that intermolar, interpremolar width. There is something called as intermolar width. There is something called as interpremolar width, intercanine width. Read more. The moment you see that it is less, it's not that wide. Look at this case here. It's so constricted. Explain to the parents about it. You know what? You take your, there are many seniors listening to me. So you take your son or daughter to the pediatrician. The pediatrician will ask the daughter to stand on the weighing scale. The daughter will stand on the weighing scale, and you see he will write down the weight. He will ask to come to stand near the height thing. He will write down the height. When he writes the weight and the height, as parents, what will you be doing? Those parents listening to me only will understand this. You will look at the chart kept behind the pediatrician. Height, weight, for the age of 12 years, 10 years, you will be looking at the chart kept there. Doctor, according to what you have written, and according to the chart, my son is so underweight, no? I always tell him to eat more. He's not eating anything. See, they are correlating with the chart there of the pediatrician. I don't know whether you can understand. Only those with kids, only those who have gone to pediatrician will understand. Nasir is smiling at least, so I'm guessing that he understood what I'm talking about. Anyways, why can't dentists have a chart behind with proper intermolar, interpalatal width, interpremolar, intercanine width displayed behind you? Why can't? Or a digital chart, or a prescription paper, tear it and give it. This is the normal, and this is your son's. There is a problem. Please understand. Please do whatever you want. But then comes the next problem. Oh, yeah, I know, doctor. I found that it is so narrow. But what do you do about it? You don't know what to do about it. The main reason why many people don't tell about many things in dentistry is because they don't know what to do about it. You don't tell about implant because you don't do implants. That is wrong. If you don't do implants, there are people doing implants. You refer out. All around the world, it is a reference practice. That is the big thing. Only in India, you send it to another clinic, he will never come back concept. I'm talking a little bit of practice management also here. I'm sorry, I'm encroaching into another field here. But refer to somebody professional who can take care of your patient in that need, whether it's implant. If you're not doing it, that doesn't mean that it's not bad. It is good. Send it to somebody who's doing it. Next, increased palatal depth. Increased palatal depth. Have you ever noticed the depth of the palate? Please, tomorrow morning, the first patient coming to you, please do that for God's sake. Check the depth of the palate. You put a full thumb up there, you can see it's a huge thing going in there. You take an impression, pour the cast, such a huge cast, such a huge palatal depth cast. That cast can be used to carry water for your alginate mixing. That big palates we are talking about. And you're not worried about it? There's no reason for it. There is a reason for it, guys. This is called compressor effect. The buccinators, the masseters, these are compressing more than the tongue force. The tongue is not up there, tongue is down. Tongue has to be up there to compensate for this compressor forces, but tongue is down, very down. Have you asked the patient to swallow? Ask the patient to swallow. Or what I suggest is, you guys listening to me now, look at the mirror or look at the camera you are on, those who are in camera. Keep your tongue up in the palate and swallow. I'm keeping my tongue up in the palate and swallowing, and look at me. I swallowed at least 3 times now. Did you know about it? Maybe you might have known about it by some movement here. That's it, maximum. Now, those who are listening to me, keep your tongue down. Down in the front teeth, in the lower front teeth. Down. And try to swallow. Ask your kids to do tomorrow morning. Please ask your patients to do tomorrow morning, just to swallow. You can see all the extraoral muscles moving. What does that mean? That's an infantile swallow pattern or whatever. Dr. Joby is going to explain all that on this Sunday. I don't want to encroach into his field, but my duty tonight is to just explain about the stuff which you cannot miss. The moment the tongue is down, what happens to the palate? The palate becomes narrow. The depth increases. There is something called as a palatal depth. There's a Karakos analysis. You want to read about it. There's a palatal depth that increases, obviously. Huge depressions like that. Last one, enlarged tonsils. Why should we look at tonsils and all? You are a dentist. Ask the kid to open the mouth. See that tonsil. Please put one word. See, note, this is pretty huge tonsils there. I think you should address it. This is called kissing tonsils. Again, you will get the same answers. You know what is the answer? I already told you. My uncle, ENT, big fellow, he already knows about it. Forget ENT. I think the most irritating answer from the parents is homeo. Sir, I know it is tonsillitis. We know it is adenoiditis. We have been under homeo treatment for the last 5 years. You don't know my uncle who is a homeo doctor, so famous. People come all the way from other countries to get treatment under this homeo doctor. You don't know about it? Guys, homeo guys are just trying to prevent infections of that. But what about the mouth breathing because of that huge tonsils and the adenoids? And what about the facial defect happening to the kid? Who is responsible? Homeo guys are responsible for preventing that recurrent infections. Before, my daughter never could take ice creams and all that, but now because of the homeo treatment, she can take ice creams. Parents are so happy. But nobody is looking at that long-term facial growth defects because of that mouth breathing. All they did is reduce the recurrence of infection. Understand that. See, no offenses to homeo people here. Even my kids, my son, my daughter are under homeo treatment. But understand the basic pathophysiology behind all this. Pathophysiology behind mouth breathing. What is exactly happening if your son or daughter is a mouth breather? What is happening to the facial growth pattern? See, everybody knows that this is a lymphoid tissue, and the lymphoid growth is like 200%. The Scammons growth curve. I don't want to go into too much of orthodontic theory. It's so irritating. Scammons growth curve, lymphoid curve is like 200% and then comes down to 100%. Yeah, everybody knows that it will be big. It will be big at the age of 7, 8, but it will regress. It will reduce in its size. Everybody knows that. But during that 3-year, 4-year, if the kid is getting a completely constricted maxillary arch, who is responsible? Is the Scammon responsible, or the Homeo responsible, or the ENT responsible? You decide. That's all I can say. God bless. 7 clinical indicators I covered. Quickly recapping, extraorally, we are talking about long face, retruded mandible, and the nasal hump. Just simple 3. Yeah, there are many, many, many more. Adenoid faces. I didn't even put adenoid faces here. Intraoral, we are talking about open bites, constricted maxilla, increased palatal depth. And the last one is the enlarged tonsil. All those who are listening to me tonight, extremely happy to announce that Online Dentistry technical team has decided to give you all a free poster. It's an e-poster. All you have to do is print it out to, I suggest, A3 size, big one. Frame it if possible, put it in your clinic. While waiting, in that waiting area, reception area, while waiting, let them just look at it. Are your kids having any of these signs? Sleepy during day. Oh my God, my son is always sleepy. Front teeth coming forward. Oh my God, that's why I'm sitting here. I want to show my doctor about this. Tired in the morning. Oh, it's so difficult to get her up for the online class. Online class starts at 8 a.m. She gets up at 7:59 a.m. Recurrent cold, fever, tonsillitis. There is a problem. It was there, but the Homeo guys have treated it nicely. Poor academic performance. She was never like the A+ in all subjects, but it's coming down. Is your child's mouth always open? All these things, they will look into it. Even if they've come for braces, even if they've come for fillings, they will definitely look into this and might strike a conversation there. That is practice management. Have this printed out into A3 size. Just wanted to finish off my lecture with one patient. Classical sign of a mouth breather. 25-year-old guy came to me with a complaint of severe gummy smile. I'm not happy with my smile. I would like to correct it. And from the side view, you can see all the typical signs of a mouth breather. There is this nasal hum, but the black blocking has taken up the nasal hum. But if you can look at the cephalometric X-ray, you can see there is a nasal hum. It's a long face. It has a nasal hump. Conventional signs of a mouth breather. And interestingly, this patient was under Homeo treatment for 15 years. And he's still so happy about the Homeo treatment he did, because he never had to take antibiotics, it seems. So the main aim of the Homeo guys is what, to prevent taking antibiotics? Come on, that's not the way to look at it, guys. There is something else going on. The kid's growth pattern is completely changed. Who is responsible for that? It's time to look holistically. I say it's time to look as a team of ENT, pulmonology, dentist, if possible, even Homeo, into a teamwork. That's the future of dentistry, I would say. So this guy wanted a flatter face. He didn't like that fullness there. I can make it flat. I made it flat for him. Beautifully flat, nice Steiner's line, or whatever you want to name it. I made it flat. But how did I do that? He has to live with these metal plates in his maxilla and the mandible rest of his life. I can change that gummy smile to nice flat smile. Not me, my orthognathic surgeon can do that. Little bit of orthodontics, little bit of orthognathics, you can achieve that, but he has to live with these plates rest of his life. And who is responsible? Who is responsible? That person who gave the drops, 3 drops in the morning, 3 drops in the afternoon, and all that, the homeo, and the ENT who said, it's okay, it's not that bad. Use a nasal spray, he'll be fine. Who is responsible? Guys, we dentists have a role to play in all this. That is my point here. The importance of sleeping properly. Are your kids sleeping properly? When I say your kids, I'm talking about your patients, obviously. Yeah. So, are they sleeping properly? Do you know the stages of sleep? Do you know what all are the stages of sleep of an individual? Sleep has 2 stages, non-REM and REM stages. Non-REM, rapid eye movement, yeah, non-rapid eye movement and the rapid eye movement, 2 stages. So let's start with non-REM. Non-REM, stage 1, you'll be thinking, why is this fellow talking about stages of sleep and all that? We need to know as dentists. Non-REM. Non-REM is that stage of wakefulness to sleep. The first time you decide to go to bed. That first time you switched off your WhatsApp and all that. You switched off the online dentistry, Zoom and YouTube link and all that. And now you're ready to sleep. You just lie down. That your wakefulness to sleep is called as non-REM 1. You haven't slept. This non-REM 2 is light sleep stage. You just started sleeping. Now that light sleep stage is a stage where you can be easily woken up. Just one sound is enough. Wife coming in or the husband coming is enough, you just wake up. That's called light stage sleep, non-REM 2. And then you have non-REM 3, which is deep sleep stage. So you have fallen into deep sleep stage. That is a critical stage there. Deep sleep stage is so critical, so important. And that stage, it's so difficult to wake you up. You try to get up, get up, get up. It's not easy to wake you up. That's a deep sleep stage. And from non-REM 1, non-REM 2, non-REM 3, and then comes the REM stage. Again, obviously, in the deep stage, you have the REM, where all the muscles are literally paralyzed, wherein you will be in your dreams and all that in the REM, and muscles are all paralyzed, so you cannot act out your dream. Otherwise, in your dream, if you're Rajinikanth, you're going to literally hit your wife or husband. So you cannot do that because you are in that literally paralyzed stage in the REM sleep and then goes back to non-REM. So this is a cycle that happens every night. In that cycle, which takes almost 1.5 hours or so, that cycle, this bruxism, snoring, all that becomes very heavy in that time of light sleep to deep sleep. So those people who brux, those people who snore, or let me put it this way, those who are mouth breathers, will not be going into that deep sleep stage much. At the moment you don't go into deep sleep stage or the REM, if that cycle is interrupted, all sorts of issues start popping up. That is why we dentists should know about it. I just want to introduce Epworth Sleepiness Scale, ESS. I do in my clinic on a daily basis. ESS. ESS is nothing but Epworth Sleepiness Scale. Ask your patient these 8 questions, 7 to 8 questions. There are some varieties, 7 to 8 questions. Simple questions, yeah. What is the likelihood to fall asleep when you sit and read? The moment you take a book, you sleep off. The moment you watch TV, you sleep off. That is that questionnaire. ESS, so important to know how the kid is performing in his or her sleep. And again, so happy to announce that Online Dentistry technical team has come out with this ESS form for all those who are attended this lecture. And it can be printed out in any size, but this I recommend to print it out in prescription pad size, that's what I have done, so that you can just tear it off to each patient, each kid, each 8-year-old, 9-year-old, 10-year-old with a malocclusion. Just tear it, or maybe 15-year-old, or maybe 50-year-old, 45-year-old. I have given these forms just to know how they are performing when it comes to sleep. And that ESS will give you, that score will give you a clear idea what is going on at night, so that you will get a better picture what to do next. What to do next, I would say, is PSG. PSG is nothing but polysomnogram. That is a sleep study. Oh my God, this dentist is talking about stuff which is not at all related to dentistry. Guys, we have to know about PSG also. A proper dental team should have a pulmonologist, should have a sleep study specialist with you. PSG is a study of the complete study of the sleep, which is polysomnogram, which includes the brain activity, which is the electroencephalogram, the electroocular, the eye movement, the muscular EMG, the heart rate ECG, the oronasal flow, oxygen saturation, snoring, all that put together, we are talking about the polysomnogram. That will give a clear idea. It's a one-day program done by our team with our pulmonologist, our ENT, and of course, Dr. Joby, about sleep study and the importance in dental malocclusions. So, sleep study, problem again is, you tell the patient, do a sleep study, the patient will come back to you with the sleep study report. You have a sleep study report in front of you. Doctor, you told about the sleep, no? You know what? We Googled about it. We went to a sleep specialist. We got the sleep study. Doctor, please look at this report, doctor. Please comment something about this report, doctor. Now you have a report in hand. Great. What to do with this report, we have no clue. Okay, but my aim today for the next 5 minutes is just to help you guys as a dentist, as a holistic dentist, looking at the health of the patient holistically. My duty tonight for the next 5 minutes is to explain to you about that one part of sleep study. If you understand that one part of sleep study, let me tell you a little bit of interest. You can read the remaining part slowly, don't worry. But that one part, that red pink stripes there, let's talk about that at least. What is that? That red and pink stripe you see in the sleep study. Those red parts and the pink parts are actually called as apnea-hypopnea index. Apnea means 100% or complete stopping of breathing, complete stoppage of breathing for more than 10 seconds. For more than 10 seconds, if somebody is having a complete stoppage of breathing, that's called apnea. And hypopnea is pink, which is 50% reduction, not 100%, 50%. Not complete stoppage, 50% stoppage of breathing. Apnea-hypopnea index. So now look at the red and pink stripe and tell me about this patient. This patient had how many apneas and hypopneas? 1, 2, 3, 4, 5, 6. 6 reds are there. So 6 apneas and 1 hypopnea put together is 7, right? Am I right? Those who are listening to me in video, at least show me a thumbs up. Fine. So we have 7 as the AHI. Let's look at the AHI normal value. More than 10 AHI per hour is a problem. Okay. More than 10 AHI per hour is a problem. So what is this patient's? Let me go back. What is this patient's? 1, 2, 3, 4, 5, 6 apnea, 1 hypopnea, just 7. Is that normal? Looks normal, right? But let me see this once more. So this is the same person's apnea hypopnea index. But look carefully. What did I tell you as a normal value? Less than 10 per hour. Per hour is normal. That's what I told you, right? Look at this. Look at this arrow. Look at this arrow. In that particular sleep study, look at what is going on in this particular patient. In 5 minutes, he had how many apneas and hypopneas? Now tell me, is that normal? Highly abnormal. In 5 minutes, he had 1, 2, 3, 4, 5, 6 apneas and 1 hypopnea put together as 7. AHI index of 7 in 5 minutes. Isn't that heavy? That is what we are talking about. 5 minutes time, he had that much apneas and hypopneas. That is the amount of sleep disturbance the patient is going through every cycle of sleep. Actually, if you look carefully at this in this screen now, you can see stage of sleep N2. What is N2? Non-REM 2. He hasn't gone into non-REM 3 and REM and all that. Remember that? I told you N1, N2, N3. It's all there. It's the same thing. So it's the same thing. It's not that difficult, actually. It just needs some mindset to learn more and mindset to look out of the window. So that is the apnea hypopnea index. This is a normal guy with no apnea, no hypopnea, normal here. And this is abnormal here. Actually, if you look carefully, way down from the apnea hypopnea, way down, you can see snore. Can you see snore there? If you look carefully, there is snore. And look one more down, you can see the oxygen saturation, S2O2, SpO2. It's all there. It's not that difficult. It's basic physiology. With some interest in learning, you can learn all this. You have to learn all this because patients trust you. Even if they do sleep study by a big time pulmonologist, they will still come to you, dentist. Doctor, please read it and please tell. Yeah, pulmonologist said many things, but I believe you, sir. Please tell. But you don't know how to read it, you had it. I think you should learn. Lastly, in my topic is ADHD. ADHD is nothing but attention deficit hyperactive disorder. One of the most misdiagnosed stuff. I already told in the video which we made. ADHD. Attention deficit hyperactive disorder. Any kid that is so hyperactive will be classified by the pediatrician as ADHD and will be referred to a psychiatrist or a psychologist. Will give some drugs and counseling. Drugs, yeah, you give some drugs. You can see the kid sitting like this with no activity at all. Are you happy now? ADHD is the most misdiagnosed concept, misdiagnosed scenario. You got to read this article by Dr. Josh Jefferson, the finest orthodontist in New York. Great friend of ours, great supporter of online dentistry, Dr. Josh Jefferson. Sir's article I have published in our website. Those who are interested can go to a website and read this article. Talks about mouth breathing, adverse effects on the facial growth, health, academics, and behavior. Academics and behavior. Now you tell parents about academic performance and behavior, they will start talking back. Doctor, you said it so correctly. He's so irritating. He's not learning anything. He's not listening. He's not looking into the online class. Academic performance. You told about interpalatal, intermolar, interpremolar, which they had never bothered. They told about ENT and all that. Now you tell about this. The academic performance and the behavior of the kid, you might start getting some attention from the parents. Believe me on that. Mouth breathing and its adverse effects on the facial growth, health, academics, and the behavior. These children do not sleep well at night due to obstructed airways. And he clearly says this lack of sleep can adversely affect their growth and academic performance. It's proven. Read those articles. Ask your parents tomorrow the breathing pattern, the mouth breathing pattern, the sleeping pattern. Ask whether your daughter sleeps in the bed with the pillow here and the head here. Morning when she gets up, the pillow is there, the head is here, the leg is here, like clockwise, it's all rotating around in the bed. Ask all that. Drooling. Pillow, I'm fed up of laundering the pillow cover. It has those big circles there on the pillow. Talk about all that. You will start getting responses, but you better know how to treat that also. That involves some amount of learning, and it's not big rocket science again. Please listen to more and more of these programs by online dentistry, I would say, or Josh Jefferson sir has great classes going on. Listen to sir. Dr. Joby this Sunday, listen to him about mouth breathing. It's exercises every kid has to learn. And when I say kid has to learn, every dentist has to learn, every dentist has to teach the kids. So listen to Dr. Joby this Sunday on this mouth breathing, the ill effects, diagnosis, how to do exercises, and how to correct it, how he has changed the life of so many kids. Please listen to him. So I am done, guys. I'm concluding my session today. All I did is a little bit of clinical features of mouth breather, typical features of a mouth breather. Tomorrow morning, you see a mouth breather, please look out of the window. I just talked about a little bit about sleep and its stages. The ESS scale, Epworth Sleepiness Scale, the printout will be given to you. Please make use of those forms. It will be all helpful when you plan about a holistic dental practice. If you're looking at just filling and drilling and filling and all that in your clinic, yeah, then I don't know what to say. But if you're talking about holistic approach, think differently, approach differently. You should be ready for even PSGs. You don't have to do PSG in your clinic. There are dental clinics in Kerala. There are dental clinics in Kerala doing PSGs. So we are on a different level, guys. If you are not doing it slowly, we might become losers. That much I can tell you. So please start incorporating all that into your practice. Dentistry is way, way beyond what you think about it. Oh, Corona, no patients coming in, so difficult. Nobody's coming. Guys, if one patient comes into you, start talking. start managing their issues. You will not have time to even solve that patient's problem. Forget the 20, 30 patients coming in next. ADHD, attention deficit hyperactive disorder. Learn more about that. One last assignment to you guys listening to me tonight. One assignment. Go to Google. Go to Google. Those who have phone now can do that right away or do it after the lecture. Go to Google or dictionary.com, or you just go to Google and type in mouth breather. Type in mouth breather and click enter in Google. Give a try, guys. An assignment for tonight. You know what's the result? The result, when you type in mouth breather in Google and enter, the result is a stupid person. I didn't say that. Google.com, dictionary.com said that. I didn't say that. It's ridiculous, actually. I don't know why Google is doing that. But there is a reason why Google is doing that. Any mouth breather, Tara Zameen Par, or any movies you take, any mouth breather is all categorized as that typical stupid person. There's a reason why they said that. I have IIT graduates who are mouth breathers. So I don't completely join with Google on that. But there is a reason why Google is saying that. Please try to understand that. Please look out of the window tomorrow morning onwards. And do not forget to attend Dr. Joby Sir's class coming up this Sunday, which is actually under the banner of Faculty of Dentistry, Lincoln University, Malaysia, where you are eligible for even a international certificate, which can be very, very useful for your career. Those students or the interns listening to me, or the fresh graduates listening to me, that can be a big thing in your career, international certificate, which you may not get that easily, because traveling is not that easy now. I haven't seen airport for the last 1.5 years. Okay, I mean, myself and Dr. Joby traveling at least 3 times every month to multiple places. Myself and Dr. Joby hasn't seen airport for last 1.5 years. So you can imagine how things are going to go in the future also, for some more time, some more months, or some more years. You never know, the 3rd wave, 4th wave, the Delta, Kappa, whatever variant coming up, I have no clue. But one thing I can tell you, look out of the window tomorrow morning itself. Try to learn more. Try to get more and more knowledge about these kind of stuff. More and more certificates, international certificates especially, which will only help you in your future. Thank you very much, guys. Please note down my personal numbers, my Insta handle, the website, the YouTube, whatever. Just keep connected. Yeah, please keep asking questions. Anything you want to know, feel free, ask me. I am ready to help you. Do not hesitate. Just WhatsApp. I will guide you on whatever you want to know, on the amount, the extent to which I can help you. Thank you, one and all.
Thank
Dr.
you,
Joby?
Vinay. Yes, thank you, Vinay. I'm
Oh,
here.
Joby, you're here. Thank you so much, Joby. I know you had a very bad day today, whole day, right from morning, like 6 a.m. I know you were like with personal issues with your father and mother together in Asta Medicity, Kochi. I heard about all that. So we didn't want to disturb you at all, Dr. Joby. Thank you so much for coming in, Dr. Joby.
Thank you,
We have
Vinay.
been talking about you, talking about your Sunday's class many times. It's good that you came in. Why don't you talk a few words about that?
Oh, yes, thank you so much, Dr. Binu. All of you listening, I always tell that you need a step-by-step advancement. When I started my practice, I was just a general dentist. I worked 2 to 3 years as a general dentist. I learned a lot. I understood this is not the future. Went for post-graduation, but after post-graduation, I again come back to zero. I said, oh my God, that is not pediatric dentistry. There is so much learned. Every time, if you want to be in front, you need to learn. Otherwise, your graph will be horizontal. If you want your graph to be vertical, you need to take the leap. And at your home comfort at the place where you are in, you are getting lots of information which you can apply directly into your practice, all evidence and ethical based, no gimmicks, no experiments, nothing. It's all evidence based there. And moreover, the first step is to learn preventive and interceptive orthodontics thoroughly, and then go into myofunctional orthodontics. And then myofunctional is not the guru, let me tell you. Then comes neuromuscular orthodontics, which is the future. Believe me, which is the future. Many of the failures, many of the TMD problems, all those things can only addressed with neuromuscular orthodontics. And we have a beautiful program called neuromuscular orthopedic and orthodontics. So we are dealing with bone first, followed by orthodontics. So be in this group of online dentistry, it will change your practice. It's not just interceptive alone, adult 45. Today I had 2 consultations of neuromuscular orthodontics only with pain of TMJ, and that can be addressed at the later stage there. So Binu, it was an awesome lecture. As usual, your lectures are so pleasant to hear, and you have added lots of other points, and it's a culmination of the advanced step of dentist must attend from mouth breathing. Is not just like giving oral screen, it's more into the posture and all the soft tissue. Amazing way you explained, you know. That's very good. I hope anybody has got any questions, you can put in the chat box. We are getting lots and lots. Awesome, awesome. Hasn't attended such webinar. Hats off. Thank you so much. Thank you, thank you. Your class always have some information. It was indeed a very informative, Dr. Ankita Kumari. So much appreciation for that. If you have any more questions, you just can, Dr. Joe, you can walk on to the YouTube. If you I cannot follow the YouTube here. I am not getting any chats from YouTube. If anybody has got any doubts, please do post it here. We can discuss. Sir is there for another 5 more minutes. Our session is going to end 5 more minutes from now. So any more doubts, we both are here. You can address that. And if you have any doubts about the coming Sunday program, what is it, anything, if any doubts are there, we are here to discuss. You can have an open chat with us. We can let you know, because it's also connected. The Sunday program is almost connected to that. And let us know if you have any more doubts regarding that. If anybody want to talk, I can unmute and the person can talk also. Let's have a discussion also. If you are faced any difficulties, anything, you can openly discuss and we can address that also. We have opportunity for that also. We have another 4 more minutes left, so that we can do that also. If you have any difficulties with respect to what Dr. Binu told, any doubts or any more clearance or any more clarifications, if you want, about 7 clinical indicators of mouth breathing. He just noted the most important things. Okay, Dr. Sangeeta Kannan, Dr. Binu, there is a question. Dr. Sangeeta Kannan is asking, sir, what are tests for mouth breathing?
Dr. Jobby, you should be answering that anyways. I think the immediate test should be whether it's a habitual mouth breather or an obstructive mouth breather. If it's a habitual mouth breather, you ask the patient to hold water in the mouth for like 5 minutes, 10 minutes, he or she will have no problem. That means it is not an obstructive mouth breather, it's a habitual mouth breather. So like that, there are many protocols. I think you are talking about even the exercises
Yes.
on this Sunday program, right?
Yes.
So if you're interested to pursue more, I think you should be joining these kind of programs, which are rare scenarios in dentistry. Don't miss it.
Dr. Aarti is asking a question. Does any a particular sleeping position influence drooling while sleep?
Yeah, there are many YouTube videos telling you how to sleep, how not to sleep, and all that. But end of the day, are your lips tightly sealed? Can you close it? Is that what matters? Whatever posture you use, if you are able to keep your lips closed. There are lip seal exercises. There are taping exercises you're talking about, right? The 3M taping also, Dr. Job is going to cover this Sunday. The moment you can get it sealed, the postures are, there are so many articles and YouTube videos talking about how to sleep, how not to sleep. But end of the day, are you a mouth breather or a nasal breather? So that is what you should be looking at.
Yes, there is another question from Ankita Chowdhury. What issues occur during mouth breathing? Oh, that's a huge
You.
that's a huge
The,
question.
the simple thing to tell you is that breathing has to happen through the nose. The nose, the nasal breathing, the nose is designed to have the thermostat, the humidifier. It has everything happening, the purifier, everything happening while the air goes to the lungs. But through the mouth, nothing, it bypasses everything. So you have to breathe through the nose, period. Ill effects starts from all that things I told you, right from irritated sleep, irritated morning hours, sleeping while driving, all that, and lack of attention, irritability. Even if you want to go more into it, even erectile dysfunction syndromes are being connected to this, guys. Okay, so I don't want to go into all sorts of big fundas here, but end of the day, it is that oxygen saturation to your lungs that matters.
Fine.
I think, Ravi, you should be answering more on that.
Yes.
You do that every day.
Yeah, yes. That's what, it's a very elaborate question that you asked, Doctor. We will be explaining it. What's the role of the elasticity of your lungs and how it works and how each part of your body is benefited with breathing to the nose and the normal physiological part of that. And if you do not, you think that you open the mouth more, you get more air. It's wrong. It's absolutely wrong. When you open more, the mandible goes posteriorly, the tongue goes down, as Dr. Benu said, and it occludes the airway and you get less air actually. So there is a myth. There's a lot of things need to be understand. We'll be discussing it that. And Dr. I just remembered one orthopedician told one thing when I had a consultation with him regarding this. So which is the best sleeping position? I asked her, so many advertisements are coming with mattress, pillow. You use this pillow, this pillow, your spine, this and all. When I asked her, a very famous orthopedician, okay, world famous orthopedic surgeon. So he asked me, Dr. Joby, you know one thing, you sleep in the best position you are comfortable without opening your mouth and stretching your neck. Only thing he told is whichever comfortable position you feel, sleep it, enjoy your sleep, but do not open your mouth and stretch your neck. So that is one thing, let me tell you. Another question, Dr. Bino, is specifically for is Dr. Kavya. Kavya is asking is, sir, is there is the ESS scoring and grading of patients?
Of course there is. Of course there is. So if all the answers are coming to more than 2 or 3 in that list, so I think you should look at that list and come back to me later. If all that is coming to something like more than 11, 12, 13, we are talking about a problem there. So ESS score has a gradient. We will cover that. Come back to me. Just get that printout, what is there in the website, grab it today itself and take a printout. One patient tomorrow, at least your own son or daughter, try to fill it up and see the ESS score and get back to me. I will guide you the importance of ESS score.
Okay, there's a very important question in Zoom. Before that, let me go to, there are two questions that has been asked in YouTube. Dr. Ritika has asked one question. Can you please tell the full form of ADHD?
Oh, attention deficit hyperactive disorder. I mean, did I say that wrongly or something during class? I'm
No,
sorry
no,
if I.
maybe she's maybe
It's
under confusion.
attention deficit hyperactive disorder. One of the psychiatric conditions, psychologist, psychiatric condition, any kid who is not sitting in one place for 1 minute, the parents take to the pediatrician. He is not sitting anywhere, he's always moving. That's called, and then the pediatric dentist or the pediatrician immediately classifies, oh, he has an ADHD issue. You got to take him to a counselor or a psychiatrist, all that. So many times it is due to his breathing pattern. Many times it's been proven. That's the article which I was talking about.
Fine. Thank you so much. That means the child is restless, cannot concentrate, do not listen to the parents' advice, do whatever he wants, no rest, no sleep, do not want to sleep also, want to be awake always, and that is called like late night sleep. That's what Dr. Binu said. It's all related to sleep medicine. Okay, now next one is by Praveen Jose. He's asked a very important question. Very important question. Let me appreciate that you have asked this question. What all can general dentists do to intercept and manage sleep disorders?
What all can general dentists do?
Do to intercept and intercept and manage sleep disorders.
Oh, it's only general dentist's role. There is no need of any specialist for a topic like this. The moment you identify there is a sleep related issue, make the patient, the parent aware about it, number one. Find out the severity of it, number two. And if that severity is more than what you think, refer, get the team of a pulmonologist. Go meet up a pulmonologist in your town tomorrow itself. Get an acquaintance, it is worth it. Go meet an ENT in your town, get an acquaintance, it is worth it. It should be a teamwork. Let them go to the ENT, find out the obstruction part, the polyps and the DNS, the deviated nasal septums. Get all that cleared by the ENT and sleep by the pulmonologist, the lung function. And it's a general dentist role. There is no other dentist, there is no other pulmonology dentist department available. It is the role of a general dentist to identify, make the parents aware about it. You identify first, make parents aware about it, and then get the team involved. If it's a very small problem, ESS scale is very low, it's not very tough, those simple exercises will take care of it. Simple exercises to get the lip seal, simple exercises to get the muscles coordinated correctly, that can solve many of the things, and breathing exercises. But if you feel you need higher level interventions, you're talking about pulmonologists, yoga, meditation, you take care of anybody's help, get anybody's help, but make sure the kid is getting that breathe, the posture corrected, the tongue position corrected, swallowing corrected, breathing corrected. It's a general dentist role. So that question itself, I would say, is not correct, because it is only general dentist role. I don't think it is related to orthodontists or pediatric dentists has more to do in it. And nobody, it's general dentist role. No doubt. Do you have anything to add on to it?
Yes, what Binu said is word by word. I underlined that because you are the people who journalists are the one who sees that first. But when we see mouth breather, we just give an appliance like an oral screen, and you believe that the oral screen will do the work or the child will do the work. Believe me, Binu have clearly told oral screen, mouth breathers has got the hypotonic lip and all those things which need to be corrected by us. And just giving an appliance or a trainer won't work. You need a lot of parameters to be assessed before giving this. So sometime it may work, sometime it may not work. And one of the most important question which I told in Zoom, you will be asking is that question is, so does nasal hump is always associated with
Yeah,
chronic?
I read that question. That's why I took this paper out from my
Yes.
book.
Yes.
See, if somebody is having a normal development, I don't know whether my camera is correctly focused.
Yeah,
If
you are
somebody
done.
is having normal development, normal mid-phase development, the arch will be something like this. But the moment you see that there is a narrow mid-phase, whenever you have a narrow mid-phase, narrow, because of chronic mouth breathing, mid-phase is not developing. Whenever it's narrow, when it becomes narrow like that, that nasal bone becomes more prominent. That's what you call by nasal hump. So if it's like this, you won't see it. You see it only when it is like this. That's why I took that paper out when I saw that question in Zoom. Anything else?
Yes, Binu, thank you so much. Such an amazing, such a clinically oriented and motivational talk by Dr. Binu. Nobody can do better than you with regards into these specific topics and in general dental practice, how we can upgrade ourselves with this clinical tips. It is an awesome to listen to you again, Dr. Binu. Thank you so much for all the participants you have come. Hope to see you on Sunday. Have a good weekend. Take care. Stay safe. Stay home. Good night, Dr. Binu and team Online Dentistry.
Thank you very much. Thank you so much, Dr. Joby, for coming in your busy schedule. Thank you very much. Take care. Good night.